Is Group B Strep, GBS, a sexually transmitted infection, STI? Have you ever wondered about the nature of Group B Streptococcus and its role in pregnancy? Today, we are going to answer a common question. Is Group B Strep a sexually transmitted infection? Group B Streptococcus is a type of bacteria that many healthy adults carry in their bodies. It is found in the lower intestine and vagina of both women and men. In fact, about 10 to 35% of adults have this bacteria without any symptoms. This is known as colonization, where the bacteria live on or in the body without causing any illness. Now, here is the important part. Group B Streptococcus is not classified as a sexually transmitted infection. It does not spread primarily through sexual activity, and it is not linked to sexual behavior. Instead, it is part of the normal bacterial community in our bodies. While it can be passed from person to person through direct physical contact, this does not qualify it as a sexually transmitted infection. You cannot catch Group B Streptococcus from food or water either. When it comes to pregnancy, the presence of Group B Streptococcus is significant. If a woman is colonized with this bacteria, it can sometimes lead to serious infections in newborns if the bacteria are passed during childbirth. To prevent this, pregnant women are routinely screened for Group B Streptococcus between 35 and 37 weeks of pregnancy. This is done by taking swabs from the vagina and rectum. If a woman tests positive, she is usually given antibiotics during labor to help reduce the risk of transmitting the bacteria to her baby. There is some research indicating that Group B Streptococcus might be transmitted between sexual partners. Identical strains of the bacteria have been found in couples, and reinfection can occur. However, this does not change the classification of Group B Streptococcus as a sexually transmitted infection. The presence of the bacteria in both partners may simply reflect close physical contact rather than sexual transmission alone. From a women's health perspective, understanding that Group B Streptococcus is a natural part of the body's bacterial community can help reduce any stigma associated with it. Women who carry Group B Streptococcus do not need to change their sexual practices or feel ashamed, as colonization is common and not a sign of poor hygiene. The focus in reproductive health should be on informed screening and preventive care during pregnancy to protect both maternal and infant health. So, to answer the question, Group B Streptococcus is not a sexually transmitted infection. It is a common bacterium found in many adults, and understanding its role can help women feel more confident and informed about their health.